Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every stomach symptom is a real story, and today we are looking at gastritis and acid reflux, conditions many people manage repeatedly at home without realizing that everyday habits may be keeping the problem active. That is why we approach digestive health from four perspectives: what the doctor evaluates, what the pharmacist safeguards, what the dietitian supports, and what you at home can recognize and manage early. This is your nursing perspective. There is a pattern these stomach problems often follow. It usually begins subtly: a burning feeling in the chest, upper abdominal discomfort, bloating after meals, a sour taste in the mouth, nausea, discomfort when lying down after eating. At first, the symptoms come and go, so they are brushed aside. Maybe it was the food. Maybe I ate too late. Maybe it's just stress. And sometimes the symptoms settle briefly, but then they return more frequently, more intensely. Meals become uncomfortable, sleep becomes disturbed, the chest burning lasts longer, and slowly the pattern begins to affect daily life. At that point, it is no longer just occasional irritation, it is a digestive pattern. And from a home care point of view, the first step is simple: observe before you react. Pay attention to when symptoms appear, whether they worsen after certain foods. If symptoms are worse at night, how often painkillers are being used, whether lying down worsens discomfort, changes in appetite, nausea, or vomiting, because patterns often appear long before complications develop. Now understand what may be happening. Gastritis occurs when the stomach lining becomes irritated or inflamed. Acid reflux happens when stomach acid repeatedly moves upward into the food pipe, and many daily habits quietly worsen both conditions. Long gaps without eating, heavy late night meals, lying down immediately after food, frequent spicy or oily meals, excess caffeine or alcohol, repeated use of painkillers like ibuprofen or diclofenac. Over time, the stomach lining becomes more irritated, acid exposure increases, and symptoms become more persistent. Now look at the system. Food affects acid production. Body position affects reflux. Medications affect the stomach lining. Stress affects digestion and sleep. Everything is connected. That is why symptom relief alone is not enough, because temporary relief does not always mean healing. The burning may reduce for a few days. The pain may settle temporarily, but if the irritation continues underneath, the symptoms usually return. So think like a nurse at home. Notice recurrent triggers, observe meal timing, track medication use, pay attention to sleep disruption, watch how often symptoms return, because the pattern is the message. Now let us talk about supportive habits at home. Eat meals at regular times. Avoid very heavy late night eating. Try not to lie down immediately after meals. Stay hydrated consistently. Reduce foods that repeatedly trigger symptoms. Avoid overusing painkillers without medical guidance. And pay attention to stress and sleep patterns, because small daily habits can either calm the stomach or keep irritating it. Now know when to seek urgent medical care. Do not delay if you notice vomiting blood, black or bloody stool, difficulty swallowing, persistent vomiting, severe chest or abdominal pain, sudden weight loss, severe weakness or dizziness, difficulty eating or drinking, symptoms repeatedly waking you at night. These may be signs of more serious complications. Now step back and look at the bigger picture. The stomach responds to food, medication, stress, hydration, and routine. Digestion is not isolated, it is connected to the whole body. So repeated stomach burning or reflux should never be ignored. The key message is simple: do not normalize persistent burning or stomach pain. Do not rely only on temporary relief. Do not misuse pain medications. Observe patterns, adjust harmful habits, and seek proper evaluation when symptoms keep returning, because early attention helps prevent long term complications. And remember to explore the other three perspectives: doctor, pharmacist, and dietitian, because each one completes the picture. Need guidance? Contact your healthcare provider for proper evaluation or call/WhatsApp +2 Bachelor 33, 208, 700, and 847.